Hi guys, this is Yolandi here from Vent Company, your ventilation specialist. And today we're going to talk about arterial blood gases. This video is a quick overview of what an ABG is and why we do it. And we will also be looking at normal values, because if you can't identify the normal values, how will you know if a value is abnormal? So if you work in a setting where you use the info on ABGs for the monitoring and treatment of patients, this video is for you. Just a quick disclaimer, this video is for informational purposes only and does not replace formal healthcare knowledge and the managing clinician's orders or findings. What is an arterial blood gas? Blood gases are mostly taken from the radial artery in the forearm and should be performed with care, seeing as the wrong sampling method can cause damage to the artery and the surrounding tissue. What do we assess on an arterial blood gas? We perform a blood gas to gather a baseline of values and to decide if current treatment is effective or if changes have to be made and how to adjust the treatment. So we look at our oxygenation status, our ventilation status, and the metabolic status of the patient. So now let's take a look at normal values on our arterial blood gas. Our pH is our first indicator of acid-base balance and is regulated by our lungs and kidneys. If our pH is abnormal, it means our lungs and kidneys are affected and are either trying to compensate or they are decompensating due to whatever is going on in the body. And thus, it reflects the function of these organs. So normal values, pH, 7.35 to 7.45. PCO2, which is partial pressure of carbon dioxide in the blood, 35 to 45 millimeters of mercury. Bicarbonate, 22 to 26 milliequivalents per liter. Normal value for base excess, -3 to +3. And our normal values for partial pressure of oxygen, PO2, in the blood is 80 to 100 millimeters of mercury. On this slide, we'll be looking at the abnormal values found in an ABG. A pH of less than 7.35 is acidosis. More than 7.45, alkalosis. A PCO2 of less than 35 millimeters of mercury, alkalosis. A PCO2 of more than 45 millimeters of mercury, acidosis. On your blood gas analysis, your PCO2 will equate to your respiratory components. Your bicarbonates, less than 22 milliequivalents per liter, acidosis. More than 26 milliequivalents per liter, alkalosis. Your base excess, less than -3, which would be -4, -5, -6, -7, -8, and so on and so on, acidosis. More than +3, which will be +4, +5, +6, +7, and so on and so forth, alkalosis. Your bicarbonate and your base excess comprises your metabolic components. Now let's take a look at oxygenation. A low PO2 can be due to many reasons, whether it's an oxygenation problem physically in the lungs or bleeding or hypertension. A low PO2 means the person is not getting enough oxygen and that the tissues are hypoxic. So by that we mean that the cells are hypoxic. When we refer to a low oxygen concentration in the blood, we use the term hypoxemia. So when we talk about the cells, it's hypoxia, And when we talk about the blood, we use the term hypoxemia. Okay, so let's test your knowledge. You can leave your answer in the comments below. These are all random values and not part of one arterial blood gas, but in ICU, as you will know, anything is possible. You can answer one of these options or all of them. Take your time. So a pH of 7.54, a PCO2 of 69, a bicarbonate of 32, a base excess of +8, and a PO2 of 55. If you enjoyed this video and you found it useful, give us a like, and you can also subscribe to our channel, where in future you'll be able to get some more ventilation related info. I really hope this video helped to either refresh your knowledge or to bring some more clarity with regards to arterial blood gases and values, and that it can assist you when you stand next to the patient's bed and you are thinking about how to proceed further with your patient. So thanks for watching, and I see you soon.